I'm here with Bonny Specker, epidemiologist from South Dakota State University, who once again this week is going to give us an update about COVID-19 and also give us a mini lesson on COVID-19 epidemiology. Bonny today is going to talk about community spread and RT. Bonny, what is community spread and RT?
Well, thanks, Chelsea. Both the CDC and the World Health Organizations have come up with mitigation efforts that communities can do to prevent the spread of COVID. And those mitigation efforts are based on the level of spread that the community currently is experiencing. And I just wanted to go over the definition of community spread and then talk about how it's important to look at both community spread and RT, which I'll also define that together. So community spread's defined based on the number of new cases in the past 7 days per 100,000 population. So minimal spread is if you have 10 or fewer cases, new cases in the previous week. Moderate spread is 10 to 99 new cases, and substantial spread is 100 or more new cases in the previous week per 100,000 population. So for Brookings, with a population of 35,000, that's about 35 cases in the previous 7 days that we have to get below in order to get out of substantial spread. Now, RT is the effective reproduction number, and we've talked about this before, but it was a couple months ago, and I thought it would be good to review that. And it's also something that's used in the City of Brookings threshold report. So I wanted to discuss that a little bit as well. But what RT represents is the number of secondary cases for each infected case. And it's important to evaluate RT while considering the level of spread in a community. So this is top part, this question number 1, is the epidemic controlled? That is the very first question that's on the City of Brookings threshold report. And what we do is we look at whether or not, as a committee, we calculate the RT and we determine whether or not it's less than 1 for 14 days or more. And if it is, then we say, yes, it's being controlled. Otherwise, it would be no. But you can't just look at that alone and by itself. It really needs to be combined with other things, one of those other things being the level of community spread. So if your RT is below 1, it's the best indication that the epidemic's controlled and that the number of cases is declining. The closer that RT is to 0, the sooner the control will be obtained. And RT depends on a variety of factors relating to not just the number of susceptible individuals, but also their potential contact with infectious people. And then things like super spreader events, those are the funerals and the weddings, those are not predicted by RT and they can rapidly affect transmission. So you may not be able to predict a super spreader event with RT. Now, as I mentioned before, RT of less than 1 for 14 days or longer could be used to indicate that the epidemic is controlled. So I just want to give some examples of the different RTs. Here we have a population of 100,000. That's the basis, to get every population at a set number. And here we have each of these little circles is representing 10 new cases in the previous week. So here we have a community that has moderate spread. There's 50 new cases in the previous week, and we have an RT equal to 1. So what that's saying is that this new case, or these 10 cases, are going to give each one of them is going to give another person the virus. So they're going to infect one other person. So essentially they're replacing themselves. That's 1. So we have 50 cases, and we're going to end up with 50 cases. Again, each one of these is representing 10 people. Here we have an RT of 2, and those 50 cases are now each going to infect 2 people. That's what the RT stands for. So we've gone from 50 cases up to 100 cases. So we have a community that was in moderate spread, and RT of 2 has now increased it to substantial spread. And here are just 2 examples of where you have an RT close to 0 and an RT less than 1, but closer to 1. And again, it's in that community with moderate spread. And if we have the RT of 0.2, for these 50 cases are going to go into 10 cases. Okay? So you'll see this is going to decrease the number of cases quite rapidly, having this really low RT close to 0. Whereas here we have an RT, it's less than 1, but it's close to 1. And it's going to decrease the number of cases slowly. So in this case, the RT, these 50 cases have now become 40 cases. So the decrease in cases is going to be much slower than over here. Now here we have a community that is in substantial spread. So we have 100 cases in the previous 7 days out of this population of 100,000, and they're maintaining that at this RT of 1. Each case or each infected person is infecting one other person. So this high number of cases is being maintained within the community. Now, if you increase this to an RT of 2, what you do is you double the number of cases. So each individual person is infecting 2 people. Now, if we look at an RT within this group that's in substantial spread, with an RT of 0.2, again, we see that it will rapidly decrease the number of cases. We're going to go from 100 cases down to just 20 cases. But if we have an RT of 0.8 with substantial spread, it's going to decrease much slower. So we're going to go from 80 or from 100 down to 80 cases. And this is pretty much the situation that Brookings has been in. We've had substantial spread for quite a while, and RT has been lower than 1, but it's very close to 1. So the high numbers are being maintained. And this shows the RT that we calculated today for the city threshold report. And you can, the brown line is the R, and the dashed brown line is the 95% credible limits around that line, or how sure you are of it. And you can see that it's below 1. Here's an RT of 1 is this black line. For most of December, it's been down here, at least the latter part of December. And just in the last couple of days, it's come up above 1, but it's close to 1. And if you look at the curve of cases, you can see that the numbers of cases have been declining. And that's reflected, this RT less than 1 is going to lead to a decrease in cases. And in the past week, we've had an increase. And that's why this R is now going above 1. But if you look on this graph, what you see here is that we are still in substantial spread. So although the RT is less than 1 here, we can say that it's controlled. It's controlled in the sense that the number of cases are decreasing, but the number of cases are still much higher above substantial spread. So we need to get this yellow line, which is the 7-day running average of new cases, down below this orange line that defines substantial spread. And ideally, we want to be in minimal community spread with an RT of less than 1. That's our goal. That's what the city's goal and everyone's goal should be. So what are the things that we can do to keep this RT down? The longer a person's infectious, the more likely they can infect someone else. And COVID has a relatively long infectious period, and that's something you can't change really. But the more people that someone comes into contact while infectious, the greater the number of people they can infect. So, and we can alter that. That's something that we can change through different interventions or behaviors. But this is also why they ask people who are positive to isolate themselves. They don't want them in spreading it to other people. And they also ask contacts to quarantine, because you are infectious for a certain number of days before you come down with symptoms. And they don't want those people spreading the virus during that period. So what can we do that can change RT? The behaviors are anything that minimizes potential exposure to others. That's where these public health recommendations are coming from. So we want to socially distance, wear a mask, practice good hygiene, get rid of the virus off your hands so you're not spreading it to other people. Another way to decrease RT is to increase the number of immune people in the population. That will reduce the RT because they're not susceptible to get infected. And herd immunity, we've talked about before. They're thinking now 70 to 85% of the population needs to be immune in order for this to happen. And you can get immunity two ways. You can either get it through being infected, and about 10% of Brookings County has tested positive, not very close to the 70 to 85%. And you can also get it through immunizations, which just started last week. We already have 2 to 3% of Brookings County residents that have been immunized. So this is really the best way to get that immunity. So in summary, a community really needs to look at RT in relation to the level of community spread, or in combination with the level of community spread. And the goal of the mitigation efforts are really to reduce the spread of the virus to minimal levels by reducing that RT. And if RT is less than 1, the spread will decrease much faster the closer RT is to 0. And the closer RT is to 1, the slower that decrease will be. Now, if RT is 1 or greater, the spread's going to increase very rapidly the further higher it is from 1, but the closer it is to 1, it'll be a slower increase. So we need to get that RT down.